Well, one thing you can count on is Dr. Gil Vardi, world-renowned cardiologist. We can count on Gil Vardi joins us in studio for cancelthisshow.com. Dr. Vardi, thanks for jumping into cancelthisshow.com for the first time today. You look fantastic in our studio. We're going to get your mic taken care of here in a second. Projo is going to take care of that. I want to give everybody a rundown of Dr. Vardi when it comes to what's happening. Do we have his mic, Joe? Because I did not hear his mic in a second. I thought you came in to fix that. He's a world-renowned cardiologist right here in our backyard of St. Louis. It's easy to take people like Dr. Vardi and other docs in the St. Louis area for granted. He is a massive, and I mean major influencer when it comes to new medical devices. And we'll show you a video of a new medical device that's coming up as well, and why it's so important, because innovation when it comes to the technology of healthcare means you, the patient, get the best care and feel as best as you possibly can. It is a privilege to have you here in the St. Louis area and in our studio. If you could remind everybody a little bit about who you are, what you do, where you're working, and how you can help people.
Absolutely. First, thank you for having me.
And can we put that mic up near your mouth too, underneath your chin? Perfect.
Is it better?
Oh, yes.
Okay.
Now you look good and sound good.
Thank you. Thank you for having me. It's a pleasure to be here. My name is Gil Vardi. I'm a cardiologist. Cardiologist is a doctor that treats heart conditions, blood vessel conditions. I've been in St. Louis area since 1998. I practice in a group called St. Louis Heart and Vascular, which has a number of locations. Main location in Bridgeton, but we have locations in Chesterfield, Creve Coeur, North County, South County. So we're kind of covering the area. In addition, I've been involved in medical device development. A few devices that I invented, and actually currently I have a St. Louis-based company called Intershunt that is developing a device to help people who have heart failure.
Tabitha, you've had some heart issues and you've talked about it.
I have had some heart issues. I have crazy arrhythmias. Like it switches from one to the next, to the next, to the next, all over the place. But right now, I don't know about you and in what you're seeing in your practice. I'm certainly not a doctor, but I feel like I talk to more people, younger people, that have heart issues than ever before. And I don't understand why. And I think this was pre-COVID. So what is going on? Why are we seeing all these heart issues in younger people?
It's hard to tell. I did see a number of younger people with complaints exactly like yours, mainly palpitations, irregular heartbeats. Hard to tie to, if you're asking if you see a raise after COVID or no COVID, it's really hard to tie. Interesting that you mentioned there's a study that just came literally January 2nd in the European Journal of Heart Disease from Korea, where they reviewed the effect of COVID vaccines. It's a large study. It covers 44 million people. And indeed, there is an effect of the vaccine, but it's extremely rare. They looked in a condition called myocarditis, which is an inflammation of the heart that causes weakening of the heart. And indeed, they saw a signal, but it was rare. It was 1 to 100,000. Interestingly, you said young people. In young people, it was 5-fold higher than older people. So there is
what the heck?
Yeah.
I mean, is that surprising to us? We see these reports of younger people dying suddenly. They call it a sudden adult death syndrome, I think now.
Sudden cardiac death,
yeah. And we've always known there were isolated cases pre-COVID. Now we're seeing hundreds of cases. And people always tell me, well, I had the vaccine and I'm perfectly fine, but they're not out stressing their heart like an athlete is. Does being an athlete and putting that extra stress on your heart, is that causing maybe vaccinated people to suffer these problems?
It's hard to tell. Again, it's very rare. So going back to this study, this is by far the best study ever because it's a national study. It's a random, it's a tightly controlled study, peer-reviewed. So they had a number of sudden cardiac death in young people. But again, the numbers are very small. So it's hard to explain, if you will, a visible rise because the numbers they reported are small. Indeed, they were there. You mentioned athletes. I'm originally from Israel, so I watch very carefully. And, Israel was very organized.
Yes, they were.
On vaccination, kind of a national task. And they did put a warning. They asked people not to go to the gym for 2 weeks after the vaccine. Again,
interesting.
There was never data that people went to the gym and died and so on and so forth. But they did give that warning for young, especially male adults. For some reason, cardiac effect of the vaccine is way more common in male than female. So,
yes.
So the trend is younger more than older, male more than female. Yet it's still very rare, but if you look to the internal trend,
but something is going on.
Well,
somewhere.
When that's we're getting questions for Dr.
Right.
Vardy now, talking with Dr. Gil Vardi, a world-renowned cardiologist and innovator when it comes to medical devices. He just told you about a company that he has, plus working with the St. Louis Heart and Vascular Institute. He specializes in cardiovascular disease. It's an honor to have you here, first of all. Second of all, when we promoted you, people wanted to know, oh my gosh, is this myocarditis? Is it a real thing? Is it happening? Is it more so now than it was 5 years ago? We have this expert. What are you seeing? Because we can all talk and say, oh, I hear this. I talked to my friend. What are you seeing in people's hearts and chest right now?
So again, I think the answer is yes, it's real. Yet, don't panic. It's extremely rare.
What's rare? Myocarditis is?
The COVID or vaccine-related myocarditis is extremely rare. Like I said, it's about, according to this trial from Korea, which is a really comprehensive trial, recent trial, 3 days ago, it was 1 to 100,000. Okay, so it is rare. Again, 5-fold in younger people, that will make it 5 in 100,000. Still extremely rare, but real.
And what about people that irrelative of the vaccine, people that were not vaccinated and are still experiencing heart issues because of just having COVID, being infected with COVID? I mean, is that something you're seeing or hearing about? Because, somebody on our comment line said, you know what, they have heart failure and they're told it could potentially reverse. Part of my issue, I have an AE reversal. There's a lot of different people that have these different heart problems that seem to have maybe stemmed from COVID itself.
So there are reports of post-COVID heart disease. It's part of what is called long COVID, post-COVID syndrome. Again, I don't see a huge rise in my own practice. I see people come, they have a problem, and they relate. They say, you know what, I had COVID 4 months ago. Is it related? The answer is we don't really know. So we don't have very strong data to really quantify and tell you. I don't think we see a huge rise. If you ask me in my own practice, I don't see a huge rise in myocarditis. Okay, it's not that everybody shows up
right
with all of a sudden, but we do see it. So I'd say it's there. Is it really jumped to the highest level? I don't think so.
I knew you'd be super popular, not only being the level of cardiologist that you are, but I knew our listeners and viewers are like, oh, they've got all kinds of questions. They're lighting everything up. And we'll try to get to the questions that you guys are asking, just so we are on a time limit with Doc today. But I did get a question, and I was trying to get back to look at it. Tabitha was talking about one of the questions, is it possible for the reversal with some of those? But Tracy wanted to know if you believe in breast implant illness and heart palpitations due to implants.
So I have not personally seen palpitation due to implants. I can tell you that years ago, and it relates to older implants. I'm not a plastic surgeon, so I am not an expert on implant. But years ago, there were some syndromes of autoimmune diseases related to implant materials. But again, I'm not the expert on that. My understanding that this is over, that the newer one are different materials. But on this one, I should really refer you to somebody who's an expert. As far as pure palpitation due to implants, I have not seen that.
Okay, it is interesting because we're talking with Dr. Gil Vardi and giving us a perspective of what you're seeing out there. You talk so much when it comes to devices, and you wanted to talk about one device that's really helping, and we have a video of it. So we're going to show. Can you kind of set up the video, what people are going to see right now?
Right. So basically, I said in the beginning, I'm a heart doctor. I treat hearts, blood vessel, etc. What we're going to see is a brand new concept. It's totally out of the box because we heart doctors, we treat hearts, okay? Heart failure, your heart is weak, we treat it by devices, by medication, but we treat the heart. This device is actually based on the finding that the brain controls the heart. So when we are in heart failure, the heart sends signal of distress to the brain. The brain, in return, makes the heart work harder, so things get worse. So it's like a vicious cycle of sending, help me, the brain sends commands that make you worse. So this device has an electrode that interferes in a nerve that typically leads the information from the heart to the brain. Not surprising, it's in the neck, right? It's right in there. So this is an electrode that is implanted in the neck.
All right.
That sends electric impulse to the brain, changing the message from the heart. And in return, the brain changes the message to the heart, and the heart actually gets stronger.
Well, this is about a 2-minute
Love
video.
that.
Here's what Doc wanted to show us today.
Heart failure symptoms suck the life out of you. Everyday activities are exhausting. It's time to take action to improve your health with a breakthrough option. A heart failure therapy that uses your body's most intelligent organ to help its most vital. Introducing Barostim, a simple device that uses the power of your brain to treat your heart failure symptoms. Heart failure is commonly treated with medications that can help alleviate symptoms. Barostim is now an effective option when medications aren't enough. Barostim is not a pacemaker or defibrillator. It's an innovative therapy that outsmarts the heart by actively stimulating natural sensors in your body that tell your brain how to regulate your heart, improving the symptoms of heart failure. Barostim is implanted inside your body in a simple, short procedure. You'll probably go home the same day. Barostim has been shown to safely reduce symptoms of heart failure and improve quality of life. Patients in the clinical study who received Barostim, in addition to their medication, were able to walk significantly farther than those only taking medication. Patients with Barostim felt better to experience life near and far. Breathe new life back into your life. Visit outsmarttheheart.com or talk to your doctor today and give yourself an opportunity to turn heart failure into heart success. Barostim, outsmart the heart.
I do love seeing incredible technology like that. How can this, we see the video, if somebody sees something like this, how do they connect to you? How do they go and start to ask the right questions about how they can be helped by technology like this?
Sure. So first of all, this is for people who were told that they have heart failure.
Would that be diastolic or systolic?
So right now, this one is only for systolic, meaning the heart has to be weak. Now, there's future research planned for people, like you said, with diastolic. In other words, people with diastolic are people who have a strong heart, but a stiff heart.
Correct.
So
yes.
it squeezes well, but it doesn't relax as well. At this time, this device is not appropriate for that, but future research is being conducted or will be conducted. It may be appropriate, but this will come a few years down the road. So right now, it's only for the systolic failure.
And how can people get helped by you specifically and your clinic? How would that process go?
Well, the main symptoms is shortness of breath. So if somebody has shortness of breath and they were told they have a weak heart, we see them in our clinics. This is not only for devices. There are a number of very modern medications now that are really helpful. So patients want to be on the right cocktail of those powerful medications. And then we have a number of devices also in addition to this device that helps the heart cope with the heart failure and improve the symptoms dramatically. So the basic thing is to come for an evaluation.
And
I love it.
Is that device approved? I'm assuming that there's a time pattern for that.
So this current device is approved by the FDA, and it's covered by many insurances, and people can get it on a clinical basis. The only caveat is that this current device that we saw requires a surgical opening in the neck that is done by a surgeon. We are involved in a clinical trial of the exact same device with a method that allows to insert it without surgery. Just insert it with a needle stick to the neck. So it's the same exact hardware, just different way of installation, if you will. The surgical one is approved. The one without surgery is still under a clinical trial, which we conduct right here in St. Louis.
Which means that doesn't require general anesthesia if that's the case.
That's correct.
And that makes such a big difference.
That's correct. So again, if somebody wants to get the device immediately, they can get the surgical one, but it takes surgery. If people want to get it without surgery, then they can participate in our clinical trial and get it right here in St. Louis.
I am all for devices. From somebody who has
it's the
heart
technology.
problems, I trust heart. I really do. I trust these devices. I think anyone who is suffering from systolic heart failure should give it a try, because I don't think people realize how much people with systolic or even diastolic heart failure can really suffer, how their lives change. People of all ages. And I mean, this is like a new lease on life for people.
Absolutely. Heart failure is the number one growing expense for Medicare nationally.
Mm-hmm.
So this is the largest, if you will, segment of disease. both in cardiology and outside of cardiology, that is growing. This is the fastest growing sector of patients, if you will. So yeah, it's a huge problem, but luckily we have a number of devices and medications that can improve the condition. For diastolic, we have less remedies. There's only one approved medicine on the market right now, but we're involved in a study of at least 5 more that could help the diastolic, including devices. You mentioned the company I have in St. Louis, it's called Intershunt, and they developed specifically a device for diastolic heart failure.
Oh, okay.
To relieve the pressures in the heart and improve the symptoms, take the shortness of breath away.
Once again, talking with Dr. Gil Vardi, a world-renowned cardiologist associated with DePaul Hospital, but you have your St. Louis Heart and Vascular Clinic as well. Is there a specific, gosh, the time goes by so fast, but is there a specific procedure that you're seeing more right now when it comes to patients? I mean, I know we asked the questions about myocarditis later, and people get worried and when you hear something and thickening of the heart and vessels and blood, but what are you dealing with most right now?
So our daily work is still blocked arteries, what we call atherosclerosis, that we open with stents and balloon and lasers. We see a lot of growth actually outside of the heart. People have a lot of blockages in their legs.
Oh.
And they end up getting amputations and gangrene and horrible things, which we can really correct if they come on time by treating the arteries of the legs with the same methods, with lasers, balloons, drug-coated balloons, stents, etc. So this is still the bulk of the work. We see growth in conditions called valvular heart disease, where the valve is either leaking or doesn't open, which traditionally needed a huge heart surgery. Open the chest and replace the valve. And there's a number of devices in clinical use where you can replace the valve without surgery by inserting it through a catheter from the leg. So I think the bulk of the growth of work we see now is treating valvular heart disease non-surgically.
And can you, before you do go, can you offer our listeners any advice to stay heart healthy? What would be your let's say, top 5 pieces of advice?
Absolutely. First of all, avoid risk factors as much as you can. And I think the most common risk factor we can easily eliminate is quit smoking.
Yes.
So quit smoking.
What about vaping?
Same bad. So from cardiovascular, I think vaping is as bad as tobacco smoking.
And because doesn't tobacco or nicotine clog the arteries?
Well,
something like that?
We don't know exactly how it clogs. We know a list of risk factors, including diabetes, hypertension, hypercholesterolemia, family history. So smoking, including vaping, is a risk factor. So stopping that it's not easy. I never smoke, but I have friends who smoke. I know it's not that easy, but definitely do that. Then go to the doctor. Make sure you don't have hypertension. If you do, take medications. If you have diabetes, change your diet, take medications. So basically, controlling the risk factors, I think, is the number one thing you can do to help yourself. The only one risk factor you can change is your genes and family history. But quite frankly, it may come one day.
That's right.
Well, Dr. Gil Vardi, we appreciate you jumping in with us today. 15 minutes or so goes by. Boom, just like that. Would love to have you back on. You're a wealth of information. We already know, or at least I did, because I've known a little bit about you and studied you, that you are a world-renowned cardiologist. We appreciate the updates, the advice. We'd love to have you back on. Heck, maybe we can figure out certain specific topics that we can jump into from that standpoint, because we need, above everything else, facts when it comes to information, because we need to know if something's serious and we need to know if something else is being made to be something that maybe it's not. And we feel as if in your expertise, you can advise us in a certain way.
And we all want to be heart healthy. I mean, we really do. Whether you have a heart issue already or whether you at some point we all will. So we need to prolong that as long as we possibly can.
And how can people get in contact with you?
Well, my office number is 314-741-0911, and that's the easiest way to find us. We also have a website, slhv.com. So you can find us through the website or through the telephone.
All right, we'll get that. And as you walk out the door, can you let Lizzie know your website again so we can pop that up for you?
Absolutely.
All right, Dr. Gil Vardi, we appreciate it. Thank you so much for joining us today.